Hmm. Yep. All right. Well, thank you, Wendy, for being here. We really, really appreciate it. Excited to learn more about you and intimacy after cancer with Good Clean Love. So I will hand it off to you if you want to do an introduction and then we can jump in.
Yeah. So anyway, my name's Wendy, and I'm the founder both at Good Clean Love and the Institute for Vaginal Health and Vaginal Bioscience and our new company that's about to launch, which is Good Clean Clinical Care. So I'll spend a few slides kind of giving you the overview of how all those groups work together and why actually the science behind sexual health is just as important as the conversation about sort of achieving sexual health. That honestly, our biology has a lot to do with how we feel and whether like arousal and desire is available to us. So I think understanding the backstory can help us sort of come to intimacy with less self-judgment and more curiosity. That's the goal here. So we're just gonna talk through these slides and, I don't know how many people are on the call, but please, if anybody wants to ask a question midstream, just, I don't know if there's some mechanism to raise
Yep.
your hand or something, but please feel free to just pipe in. And a lot of times these side conversations that people bring up are, in fact, as interesting or more interesting than what I have planned to say. So, so don't hesitate, please. Okay, so next slide. So this is a really great place to start about what is the vaginal microbiome. And I know that we did a talk earlier where we went through a lot of this material, but many of you here might not have heard that. So I'm just going to do a quick once over again. Most people and many cancer survivors have never been introduced to the idea of the microbiome. And so I'm going to even take a step behind this vaginal microbiome and tell you that, like, probably most people who might be ever listen to this talk have heard about the gut microbiome. But one way to situate how the vaginal microbiome and the gut microbiome are related is to understand that the microbiome, the human microbiome, starts at the top of your body, in your eyes and your sinuses and your mouth. That's all microbiome tissue. And how you can identify microbiome tissue is that it's mucous membrane. So when you think about what the tissue inside your mouth is, how different that is from your skin, for instance, that type of tissue, that mucous membrane goes all the way down your esophagus into your gut and then exits out of the vaginal and rectal openings. All of that is your microbiome, and it's literally 3 pounds of bacteria that is designed as our immune function. So each different area has its own kind of lactobacilli that protects it, which is to say that in the gut, acidophilus is reigns supreme, whereas in the vagina, it's a different kind of lactobacillus. It's a crispatus type that's more native to these different areas. But that said, it's like the gut is the most complex of all the microbiomes. But the vaginal microbiome also hosts like 6 different types of lactobacillus when we're most healthy. And these, like it says here, produce a lactic acid. So it creates a virtuous circle, right? It maintains a low pH, and they need a low pH to survive. It protects the vaginal lining, and it also is an immune barrier. And so it's really important, right? It's like how you feel normal. When you feel normal vaginally, it's because your vaginal microbiome is intact. And it is really sensitive to your hormone levels and is a contributor to the inflammation and stress that you might experience as well. So, and we really want women, especially cancer survivors, to understand that a lot of the experience they're having is not just a feeling they're having, it's actually a biological reality that they're in. Because when you go into cancer care, frequently estrogen is related to the cancers that women experience. And so most women in reproductive cancers have go through a chemical menopause, which is much more severe than a natural menopause, even though natural menopause also does the same things. But and all those things really impact how your vagina feels a lot. Okay, so next slide.
Just kind of out of curiosity, and like I don't even know how to properly word this, but like going through cancer and going through early menopause or like forced menopause, like how do we now know what normal is like, you know?
Well, I mean, you might never know normal like before your cancer treatment,
Yeah.
right? And so the everything that we're gonna share today is really and but and I don't want to make light of it's a serious loss. Not, the cancer diagnosis in itself is a loss, and all the things that your body goes through are a real loss. And especially for so many women who are having that happen to them at really young ages when they're in the prime of their reproductive health, or they should be, then you feel it even more as an acute loss. And so, I believe, and this is why we launched this new telemedicine platform, that with the right care and movement towards biomimicry, we can biomimic you back to what feels normal. That's basically the goal. So your body might not do that for you again because like it's really hard to I mean, I don't even know if you had the right lactobacilli before all of that. Many of you might not have, because we haven't really come to a place in medicine where we look at the microbiome at the time of cancer diagnosis, reproductive cancer diagnosis. But we do know, and there's a lot of studies, I'm not sure if it's in this deck or not, that for sure the cancer treatments really wreak a massive havoc on your microbiome. So you definitely are not coming back to your original microbiome after all that cancer treatment. So did I kind of answer you?
Yep.
We're going
Nope,
to
you
show
did.
you how you can get back to something that feels normal. So the microbiome serves multiple really important functions. Many women don't find out about it or start to think about it until they can't get pregnant, right? Because your microbiome really does impact your ability to be fertile. If you have a dysbiotic microbiome, it's frequently associated with high levels of infertility. It also is required to support a healthy pregnancy. So when you have an ongoing, and this is particularly true for women of color, again, we know that this is true, but we don't have the evidence of why it's true. We know that it's true not just in the United States, but also in Africa and other countries that for many reasons we don't understand women of color, not just Black women, but Mexican and Asian women, do not have always the healthiest lactobacilli makeup. And we don't know why that's true, but we do know that that is often linked to to preterm birth, miscarriage, and poor birth outcomes, which is a much higher percentage in women of color. So when you have good lactobacilli, their job is to prevent infections, and to block harmful bacteria, yeast, and viruses from implanting in the vaginal wall. Um, and again, like we were talking about your reproductive health for all the way from fertility, STI risk, and long-term vaginal health. It's all affected by your microbiome plays into all of that. And the way that women know it or feel it or experience it or can articulate it is that they might have a vaginal odor that makes them embarrassed or ashamed or that they feel really uncomfortable with. That's like a sure sign that you're living with a lot of unhealthy bacteria and that your healthy bacteria are not managing those unhealthy bacteria. Also a sign that maybe your pH is really high. Other signs that you might have besides odor is, strange discharges that might be different colored, yellow, gray, white. Um, and it's confusing because many of the conditions and infections that women can be diagnosed with have shared symptoms. So it's really easy to get misdiagnosed. And in fact, depending on the study you look at, 1 in 3 or 2 out of 3 women are misdiagnosed every day in this country and frequently put on long-term antibiotics, even in pregnancy, when we're not even looking at what is the bacteria that's affecting here. So these are just some of the things that infuriate me. Okay, so let's do the next slide. So I feel like I've said this, so I'm just going to say it one other time. The microbiome actually is the key um, um, the key to the immune system functioning in the vaginal area. So when you're balanced, you don't have the inflammation and redness and irritation that you might come to feel is normal, right? So a balanced microbiome eliminates those symptoms. Um, when you have healthy lactobacilli, they actually create a coating on your vaginal epithelial wall, which is the inside of your vagina, to stop bad bacteria from breaking through. And so, in that way, they're natural antibiotics. And that's why estrogen is such a key player in all of this, right? And the final thing that when that system is working, your pH is really low, right? The lactic acid that's generated in this virtuous cycle keeps your pH to 3.5 to between, it's actually 3.7 to 4.1 is the ideal. And when you can manage maintaining that low pH, then these bad bacteria die off themselves because they need a much higher pH to live. Um, so that's why our products are designed to reduce your pH consistently over time, because just that one lever can get these bad bacteria to die off and create an environment where good bacteria can live. So, okay. Anybody questions so far? No? Okay. Next slide. Um, so this is kind of interesting, especially when we get to the fourth box around cancer treatment. And this is where there's some studies that have been done. Um, uh, that your microbiome is changing throughout your whole life. It's a dynamic system. It's not like you have a good microbiome and then you're just through the rest of your life you have it, right? Like it's like as a small child, you don't actually really have a dominant lactobacillus microbiome. Not until you get to be pubescent does it start to wake up. And like some women have healthy bacteria right from the start, and some women don't. In pregnancy, like the system is supposed to go into hyperdrive so that you really start to get a lot more protection. That again, that doesn't happen with all women, especially not women of color. But cancer really can shift the vaginal microbiome to like not having healthy bacteria, raising your pH, and increasing inflammation and all kinds of other conditions. And that's because of these aromatase inhibitors and many other drugs that you're required to take when you're going through cancer treatment. Again, radiation, which we, aren't totally focused on here, but, that can completely destroy not only the vaginal microbiome, but the vaginal tissue itself. And so those all deserve palliative care. And what we know is that many, many women are not getting care about this really serious outcome of cancer treatment. Menopause is the natural place where these things would happen. And of course, like now everybody, all the stars are talking about menopause. So it's like kind of a big thing. But it's a challenging time in life because we really, until we lose our hormones, we don't realize how many great jobs they did for us. But endocrinology is literally the backbone of how we function well in a human body. And it's not a well understood science, and it's not well addressed. But it's literally core to not only like how your vagina feels, that's how what we always focus on, but it's also a neurological hormone. I mean, it's a neurological hormone as well. Estrogen very much affects how your brain works. And so, if you kind of have this sense that you don't know what you're doing or you can't keep track of things, this is all estrogen driven. Same thing with your heart, right? Like the reason women have such high heart disease is because estrogen also impacts how the heart works. I mean, so it's just everywhere. And it's not just estrogen, right? It's also progesterone, it's testosterone, it's all these hormones that are really impacted and seriously impacted in cancer treatment. Okay, so next slide. So this is a study that we conducted many years ago now, but so I feel like I've said a ton of times already about how we want to keep the pH low and we don't want to disrupt the vaginal lining. And so the products that we make are uh, what we call biomatch, and they do three things. And this chart on the right shows you what hyperosmolar products do. So on the very top, this is like sort of the control study on the top. That's what your vaginal lining should look like. That pink substance is all these cells that are working on your behalf, protecting you. And you can see that Good Clean Love is pretty similar. And then as you go up in osmolality here on the right, on the left, um, the higher the osmolality, that's like the osmolality is the measurement of a formulation's weight, chemical weight, or salt balance. So, when you look at a product like Astroglide or KY Warming, those are generally made with ingredients like propylene glycol, polyethylene glycol, methylene propylparabens. Those products are all chemically heavy. And propylene glycol is a code word for brake fluid and antifreeze. So when you think about salt balance or just like even temperature balance, antifreeze by definition is a product that's designed for engines, brake fluid, to withstand high temperatures, right? Or low temperatures, right? Like it doesn't freeze. Like that's the whole point. But that's not a good match to that most sensitive tissue in your body. And so you can see within just 4 hours what these ingredients do to your vaginal epithelium. That's what you're seeing in that chart. That's called histology. It's a histology chart. But you can see that it completely shreds that. So what happens when all of these cells dry up or all the moisture gets pulled out of the cell, and so all this excess water is in that vaginal area. It's pushing your pH up, and then you basically have a bacteria party there. So you can see that when women have been exposed to even an ultrasound gel, that's hyperosmolar, within 1 day to 13 days, they have BV, which is the overgrowth of bad bacteria. Um, so the products that we're giving women are not helping them to stay balanced in their microbiome, which is just kind of crazy. It doesn't make any sense that that's like what the FDA concludes is safe. I could say a lot more about that, but we'll just skip that for now. Okay, so next. So none of these products can help you biomatch. So this is our biomatch set that we recommend for cancer patients. It's a wash, that's an external wash. So it's very gentle. It's not a high sudsing wash. It's made with 65% organic aloe. And what it does is aloe is a great ingredient to help lactobacilli. It feeds lactobacilli. So it's kind of a prebiotic in that way. This will bring your pH down to 4 and 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 that's where you want your pH to be for healthy lactobacilli to hang around. And then the Restore gel, also an aloe-based gel. We also have some that are not aloe-based. We'll do that for in the inside, bring your pH down to 3.7, all the while feeding and encouraging healthy lactobacilli to hang around. And the reset is actually provides the native lactobacilli for that environment. And so when your microbiome is healthy and stable, then you might think, oh, sex. Yeah, maybe I want to have sex. But if your microbiome is out of balance, we've been just doing this study in Nebraska that we actually see evidence that women having nothing to do with cancer at all, whose microbiome is imbalanced, do not have the same response to arousal and are not having the same kind of desire. Because just think about that whole gut brain thing. There's also a vaginal brain thing. And, the health of your microbiome, which functionally is really about procreation, I mean, in just a primal way, isn't functioning when that microbiome is not functional. So we've done some studies on that too. But anyway, this is the product set that we send samples out for cancer patients, and we have this as a product bundle on Good Clean Love. And we're even taking this a step further and developing a new website, which hallelujah is going to launch on by July 6th, maybe before, called Good Clean Clinical Care. And so basically for all the medications that you need, whether it's low dose estrogen, if you can take that, if you can use that, it's all made in this same technology of biomatch so that it's not going to disrupt your vaginal microbiome when it's supposed to be treating you. So I can say more about that later.
I just want to make sure. I don't know if I'm not used the raise hand feature very much in Zoom, but Lauren, did you have a question? Is your hand up or is that an accident?
Is up. Can you hear me?
Yes.
Yeah,
My question is, could you use these at any time? Like, if I order them today, can I use them today and see how it works? Or do I
you
like,
can use them anytime. Are you in treatment?
I am not, I'm on long-term medication. So I'm five
Yeah,
years
you can use that.
out.
Yeah, you can use them today, and we'll give you guys a code
Yeah. I'll find the
at the
code for
end of
you and
this.
we have a code with Good Clean Love, so I'll send it
Okay.
out via
Okay.
email as a recap.
Okay,
So,
great. So yeah, you can use that code and for sure start using them. You'll start feeling better. Like, I mean, I don't know what your condition is right now, Lauren, but you'll feel a difference within days. Maybe not day one, and the gel might be a little bit warming if your pH is really high, but you'll see that that response recedes with each use. And
I
so
feel
if
like
it
I have like without getting too personal. Like some days I feel like I have symptoms and I'm like, should I go see the doctor and get antibiotics? But I'm like, then I'm fine for like another 4 days. And I'm like, no, I feel like I'm pretty quote unquote normal. But I'm like,
uh-huh.
what?
Yeah.
Like, it's one of those where I don't feel like I need antibiotics, but I don't feel
Yeah,
like,
but it's not normal. Yeah. I mean,
right.
a lot of women are in that situation. And are you taking aromatase inhibitors?
Yes.
Uh-huh. Yeah. So these products will make a big difference for you, a big
Nice.
difference. And you should just use them every day and don't use anything else. Don't
Okay.
use any other wash. Don't use any other vaginal gels and don't use any other suppositories. And if you need a lubricant, we have really good lubricants. I would recommend the BioNude.
I've
Um,
actually used yours, and yeah, they're
okay.
great. I didn't know about this product though.
Yeah, but so this is the everyday stuff, right? And that'll make the lubricant work even better, honestly. Or and it'll actually also help you even want to use a lubricant. You know, if your vagina is feeling normal and you start to smell like yourself again, all those things will really contribute to thinking about like, oh, sex. Yeah, maybe I'd want to do that. So for sure, we'll put that code up for you, and you should grab them.
Yep.
Awesome.
It'll really help. Okay, so I think we're going to talk about sex now, right? I think I'm through all these slides and uh, so this is just kind of stating the obvious. 80% of patients after they have radiation have severe vaginal pain. A fun fact, terrible fact is that when women don't get any palliative care after radiation, the percentage of women who have obliterated vaginas, which cannot even be treated surgically, is really astoundingly large. So whatever. The tragedy is that these women are not even sent back to their gynecologists usually after they go through these really unbelievable treatments. Like I said, for all the reasons we discussed, they don't have lubrication anymore. And 30%, I mean, I think these numbers are pretty conservative, but um, vaginal dryness and inflammation. I mean, every woman I've ever talked to who goes through cancer or is in cancer treatment has vaginal dryness and inflammation. So I don't know where they get that 30% number, but I think that's generous. So if you're having any symptoms or you know anybody who's having symptoms, just know that you are in a large group. And it's like when you have these feelings, you don't want you don't want to have sex.
Hmm.
It's like antithetical. In fact, I was at this Mayo Clinic conference and there was a panel of women survivors that were like talking to all these physicians. And um a lot of clinics have like this sexual health recovery centers or whatever. And I said, and a lot of the women are like, I don't want sexual health recovery. It's not even like on their list. I'm like, but would you want vaginal health recovery? Yes, they would want to feel better vaginally. Then maybe they could talk about sex. So I feel like a lot of times this is backwards, what we do because women's sexual health, even having nothing to do with cancer, is a complicated topic. And we're always made to feel somehow broken or wrong if we don't want it when somebody we know wants it. And I just feel like it's misleading that's the nicest way I can talk about it. So I'm just going to give you some ideas and talk about sexual health anatomy and some ideas of ways you can come to approach your like this question, like leaving it as an open question. Do I want to be sexual again? Maybe. I don't know. Like maybe you do. And here's a few like gentle ideas that would help bring you back in your body to think about it. Um, okay, so anyway, that's me a few years ago. Um, you can see I'm aging when you see these pictures of me and you see the real face. It's like um, okay, so this is like thinking about your senses when you think about sex. This is actually one of the most basic ways to start thinking about your body as a sensory organism. And that's the entire goal here, right? So, um, you know, I mean, I'm not going to read these slides to you, but when you go through your senses, I think what's most powerful is scent. It's always where I start. Um, and so we have these love oils that are going to launch again any day, like hopefully for sure by August or maybe before that. Um, but let me just tell you about how scent works with your sexuality. So scent, where you smell through your nose, goes into your olfactory bulb. And conveniently, your olfactory bulb is co-located with your limbic brain, which is what your limbic brain, which is at the back of your skull, is responsible for memory, emotion, and sexuality. So, and of course, your sense of smell. So think about the combination of things that get processed there. So when you heighten your sense of smell with something that is, nice for you, that's a turn on for you, a smell that you can associate with intimacy, what you're doing is stirring up your memory of other times that you liked sex. So it's like this reminder, oh, that's right. I smell this. Oh, yeah. I still do this for myself, honestly, because it's not like when you're 20 years old and you meet a really great guy and you can't wait to do all the things, you know, as you age and you go through these traumas of your life, you have to teach yourself ways back into wanting that kind of intimacy. So scent is a really powerful one because it works. It's where your emotions are stored, and also your arousal mechanism is there. So your emotions, your memory, your sense of smell, and your arousal mechanism, all, God, thank you, live in the same place. And if you take advantage of that, it can actually help you to like wake up your arousal mechanism and not have to rely on desire because desire is a slippery slope. It's very hard in a complicated life to always get your desire to turn that cycle on. Arousal is much more accessible. And so anyway, I'm super excited. We're going to have these love oils back in market. I don't think anybody makes anything better. There's some other CBD oils that are around and some people really like. I've used them also. But the thing about a scented oil, if it's the right scent for you, is that it smells different on you and your partner, and it creates a unique scent between you, which is kind of a super sexy thing. And any body part that's slippery is way sexier than that body part dry. So it's also tactile, right? Like when you use oils or other things to really feel people, it like not only slows down the intimacy, but gives you really a lot of sensory input for what does it feel like to be sensuous, to feel sensual in your body. Um, I don't know if any of you've seen this show on TV, but I can't help but bring it up again. But this show called Off Campus, which my daughter made me watch, but it's actually kind of cute. And the guy is like, it's a long story, but he's like trying to help this girl have an orgasm after she's had been raped. And he goes to his friend, well, you seem to know. And his friend says to him, well, don't skimp on the foreplay. And it's like, in fact, go 5 play, 6 play, 7 play. And these are like these cute college kids. You would never think they would know that, but it's TV. But that's actually a great message, right? Like you really, really want to give yourself as much time as possible to have as many experiences as you can that brings you into your body and out of your head. So, and that's actually what prevents a lot of people from having a moment is that they're like thinking about how they look or they're still feeling traumatized about what happened to their body, or any number of things. And like all understandably so. So all we're trying to do is come back to like our basic sensory experience for as long as we can. And touch and smell are of the most powerful that you can use. Sound is also great. I just want to say if you don't have a good sex playlist or an intimacy list, we have a couple that we've been listening to literally for 30 years, I think. Um, And they're good because we only listen to them when we're doing that. And so it totally sets the mood, right? We've done it, I don't know, however many times over 10 years or 20 years. Um, and it also brings me to a time when I didn't have as many things going on for me physically. So it's like, sound and music evokes memory, right? And also getting to that same place in your brain. Um, and and this middle one is like about fantasy. I don't know what all these exclamation points are for, but I didn't make this deck. Um, but fantasy is something I was talking about yesterday on this podcast. It's like so important because it's literally the rocket fuel for your sexuality. But it's easy to misunderstand fantasy. We have a whole romantasy thing going on at Good Clean Love now because so many women are loving romantasies. And I actually am a romantasy reader myself. And there's some really amazing statistic about like women who read romantasy are 60% more likely to want to be intimate. So it actually really works, right? It works the way that, girl erotica also works like that. There's this really cute, I mean, it's some also very sexy. There's this app online called Quinn, and it's just completely auditory. And there's like crazy, like these men, like sort of doing all this crazy audio stuff it's very erotic, I just want to say. But there's also some really great stories, like the actors that were in Heated Rivalry have this really sexy story that they each play a part. So there's interesting things on that, but that is enough to like make you like remember what it was to feel those things. And that's like a big part of coming back to your sexuality. And none of this has anything to do with having sex, mind you. I haven't talked about having sex at all on this sheet. And I really recommend not even thinking about penetration when you first come back to this because that could maybe not go the way you want and then set you back a long way. So like if you can't get to 4 5 6 play in and you can't and you definitely cannot do that in 7 minutes. And the average time that people have sex in this country tragically is 7 minutes. And you can't do any of these things in 7 minutes. So like give yourself a half an hour to want to feel something. Um, okay, I have to put a new slide in this deck, but I'm also feeling compelled to tell you about this even without the slide. So we'll go on to the next slide in a minute. But only 3 months ago, in March of 2026, was the first time that the clitoral organ system was mapped ever in the history of the world. And the first time I ever even learned about it, I was 39 years old. The first study that came out about understanding that the clitoris is not actually a little gland on the top of your vagina. It's actually a very complex and miraculous organ system full of 10,000 sensory nerves. So there's no body part, man or woman, that comes close to the clitoral organ system in its ability to feel. And so that glands on the top of your vagina actually has legs that go up the vaginal walls 11 centimeters all the way to the back of your vagina, where there is indeed a spongy G spot area where, like, once all of that stuff is super enervated and filled with blood because you've taken the time to have a clitoral orgasm, you're actually able to have penetration that is nothing like the penetration you have when you haven't done that. Right. That's like women, what that's like, say, I have painful sex. Well, because the system is not prepared to receive any kind of input. So I'm going to just do a little shout out for my friend Alex, who has this company Dame. And I've tried a lot of vibrators in my life, and the 100-time winner over and over again, travel with it everywhere, is a little vibrator that they have for the clitoris. It's seemingly gentle, but incredibly effective. It's called Air, AER, is the name of that vibrator. I literally have tried all these clitoral vibrators, so I can tell you with some confidence that this is the best. And it's amazing when you like think about that this organ system, this clitoral organ system, was literally built for pleasure over time. It's not like a man who like has an erection, and often he's not thinking about a woman's pleasure because he himself feels insecure about being able to finish because 50% of men can't. So they have performance anxiety too, but they won't ever talk about it. And so they're always in a rush to get their system to work without really realizing how much rich, incredible energy a woman will bestow on them by taking the time to let this flourishing clitoral system do its job. So if you've never had this kind of orgasm or you don't know about it, there's a great book. It was written by Rebecca Chalker. This is the book I read when I was 39, and it's still one of the best, called The Clitoral Truth, available on Amazon. And and if you learn about this organ system and you start to be curious about it, I promise you it will change your sex life. And provide hours of fascination about the miracle of the female body. So this is why they don't want us to know about it. It's 2026 and they're only just now applying scientific tools that they've had for decades because this makes us powerful and they don't really want us to be powerful. So whatever, to hell with it. Okay, what's the next slide? We do need to make a slide about that though.
Mine's still blown. Yeah, you definitely need to slide about that.
I'm going to make a slide about that. So this is again kind of a sensory thing where I'm just asking you to I don't know what is with all these exclamation points. I didn't study this deck, so I apologize. I have no idea what those exclamation points are doing there. I don't think they were supposed to be there. But honestly, this is just like thinking about your five senses and just like actually giving yourself like counting, right? Like one Mississippi, two Mississippi. How long can you stay with any of these senses, even if you're just with yourself? Right? Because it's not easy to do. And so, again, for me, the easiest one is my sense of smell and touch. But, also, like I said, I think a good soundtrack or listening to some interesting erotica is good. I'm not so much about the visual stimulus personally, but God knows that 50% of the internet is full of pornography. So you can pretty much find anything you want on that. It's really kind of a scary rabbit hole, though. You kind of go down one thing and suddenly you're getting all these things, and it's like, no, please forget you ever saw my name. So I can't give you any impetus on that. Men tend to be much more driven visually, I think, than many women, but this is like really just about coming into focus with your senses and giving yourself the time to like really use and focus on a single sense. And again, my favorites are smell and touch. But whatever, although I do have to say when I listen to Quinn, I can get pretty caught up in that also, some of them. Okay, so next slide. This is a really important slide, actually, because our sexuality is really so deeply impacted by our ability to feel and to identify and name our feelings. Um, and you know, if you have shame about your body, you are in a very large group. And if you have fear and anxiety because maybe you had unwanted sexual contact before, or because your body doesn't feel like you anymore, you also are in a very large group. If you have a lot of grief and sadness because of what happened to you or some other life events, I lost a child in 2018. And I wondered if I would be able to have sex again after that happened to me. But I've talked to a few friends who had cancer treatment who had that same experience. Like, I don't know if that's even available to me anymore. And I would say this to you is that, like, you have to be able to, rather than close off to those experiences, you have to be able to have them. You have to be able to have your emotions and befriend your emotions and befriend yourself. Because what people don't understand is that when you cut yourself off from any single emotion and just say you only want gratitude and joy, like, who doesn't want those ones on the left, right? It's not like that. You can't just choose some emotions and decide I'm not going to feel these other ones, because what happens is it just mutes the entire experience and you become numb in many ways, and it's really hard to be sexual if you're numb. You can't, it's a very challenging place to be. So, honestly, after I had sex for the first time after I lost my son, I just sobbed. I did have an orgasm, but I just sobbed and sobbed. And so, I mean, and other times, I mean, so let me just say this about orgasm. It's the forbidden fruit between Adam and Eve, and that's because the religious people knew that when people have a profound orgasm together, that's a way that you really feel pretty close to God. And it's also the most coveted of all experiences because it not only resets your physiology, but also your emotional health and your mental health and your spiritual sense of connection. A good orgasm does all of those things. And if you share that orgasm with someone you love, you actually love them better for a minute. So, so it's a really profound experience. Many women, an alarming percentage of women, never have that. And in fact, worse still, they can't even sort of feel comfortable with their own body to try to find that experience with themselves. They have a hard time feeling like, oh, something's wrong with me. I should be finished. I'm not finished. And that's not true. Like I told you, this clitoral organ system is built for time. And so whatever time it takes, although that air vibrator really helps me a lot in that. That's what it takes. And who's in a rush for this part of your life anyway? So I guess this is the thing. We have to be willing to have our emotional life, and we have to be willing to give ourselves the grace of curiosity and courage to come to understand what it is that works for us, because then you can share that with a partner. So no one gives you that experience, right? Like that's your experience. Your orgasm is yours, but it's really a beautiful thing to share with somebody. And it should never be something that you feel ashamed or worried that you can't produce fast enough for somebody. That is like the wrong track. So, but whatever, like, you just have to be ready for it. And, this was really interesting. This podcast I was on, this woman, like, feeling like what it took for her to give herself permission to want to know that about herself. And so I am right now bestowing permission on everybody watching this video that this is your right. And you are blessed with this incredible sensory system that every man does not have, so, like, want it, and feel, let curiosity lead you there. So, okay, next slide. This is about sexual courage. So I wrote this book called, I think a lot of these quotes are from my book, actually. It's called Sex That Works. I can't remember what the subtitle is, but about being courageous about your intimate life. It's not actually a manual about sex, but it's like it takes courage to be sexually open and to be sexually awake. It takes courage, especially in the world we live in now, and especially after having gone through through cancer, and so or through any kind of tragedy, like being, there's nothing that we do that's more vulnerable than allowing someone to know us and see us in this deep place of pleasure. And I might even say pain, right? Like that's something I've been exploring a lot, but it's not unusual that you have both those experiences at once. And so you have to be willing to have the experience. And it takes a lot of courage. And the thing I would say about courage is that sex is a developmental skill. So when you're young, like uh, in your teens and 20s, you do not have the developmental capacity that you do in your 30s or 40s or 50s to actually know your own body and be willing to be vulnerable with that. Certainly, the experiences that many of you have gone through sort of make that even more complex. But so you have two choices. One is that you can get stuck in a developmental stage and never go on and never really know your sexual health or your sexual being or your sexual self or what it is that brings you pleasure or how to have an orgasm. You can choose to avoid all of that. And there's a lot of women who do, partly because they've had erotic injuries when they were really young. Postpartum is a really hard time for women in so many ways. Many women give up having sex after that. And again, after cancer, a lot of women never go back to wanting to be sexual for a lot of different reasons. Um, but what I would say to you is that that sexual courage is really, really tied to the development of you as a human being. And so if no, because like the ability to do that is, it's like the way we do everything is the way we do everything. So this courage and this development reaches across your entire life, right? Suddenly you realize how bold you are in all kinds of things that you ask for in your life. And hopefully sexual pleasure is one of them. So, is there any more of these, I think? Is that the last one? Okay, this is a good one. And so let's just do that last slide for 1 minute. So I wrote this other book. It was called Love That Works. I have like 4 more minutes. Does anybody have any questions before I explain this? Okay, I'm just going to keep talking. So I wrote this book called Love That Works, and it's based on this ecology. And so the thing is that sex is the reason that most people blame when they leave a relationship. And so sex is the fire in an ecology, in a relationship. But all these other things have to be true in order to have a fire. So think about a fire. What is the ground of a fire? That's like how we think about ourselves and how we think about our partner and how we think about what we're doing together. And if we only have bad thoughts, not only does our partner definitely know that, even if you don't say it out loud, but you can't build a fire on a marsh, or a volcanic ash. You need real ground to build a fire. So looking at how you think about yourself and your relationship is crucial to being in any functional relationship and actually anticipating that you could have sex in it. The other one is how we communicate. So that's the air of the relationship. And I don't know if you've ever been around people who don't say anything to each other, who never self-disclose, who never talk about how they feel, who hold things back. It's like there's no air to feed a fire in those relationships. And so to the extent that you don't feel safe to communicate, how can you possibly feel safe to build a fire in that space? And the last one is just as important. It's this ebb and tide of togetherness is like what I call showing up, right? So the water in the relationship, it's not like everybody's like has somebody who's there for them every minute all the time. That's not realistic. But if people don't show up for you ever, or you never feel like somebody has your back, then there's no way you can feel safe in that relationship. And that's different for different people. We could talk about this at length, but like if you don't feel like there is someone showing up for you, there's no water. So again, the fire is not a safe thing to do. So all of these other things, how you think, how you communicate, and how you show up is what makes it possible to have a fire. And so don't blame the lack of sex for what is happening in your relationship. Really commit yourself to moving into some of those things and doing the work so that sex could be a natural outcome of those things. Huh. Okay, that was a lot. So,
No, it was amazing. It was such good content.
yeah, I get Rebecca, I don't know if you're on here, but we need to change these slides up a little bit.
She dropped off.
The clitoral organ system we got to add into here.
No, this was fantastic. Any questions or
It's okay. Probably people are embarrassed, but they can listen to it
yeah, no,
again.
it's here.
Hopefully they'll get some of those resources, um, and start learning for themselves. There are really an amazing number of books, an amazing number of people who really can support the growth of a healthy sex life. And Ashley, if you want, I can send you some names of some books and authors that I
Yeah,
really like,
yeah,
and
that'd
you
be great. And
pass it
I'll include
along.
it.
Yeah,
Yeah, I'll pass it
yeah,
along. Yeah.
100%.
Actually, I have
Um,
a question, but I can't figure out how to raise my hand.
Oh, that's okay.
So, like, kind of stepping way back to when you're in treatment, how do you think we can cross that barrier of like oncology centers educating women about what can happen to their vagina during treatment? Because, like, when all of a sudden I experienced all this dryness, I kind of had done some research, so I kind of knew what was happening. And when I brought it up to one of my providers saying, when you're doing all this chemo teaching and everything, it might be nice to include something of what could be
yeah.
happening. And if you
Mhm,
experience it, let us know so we can help you. And they
mhm.
told me that they didn't want to overwhelm women too much
I mean,
during
it's
can
it's
and
just such bullshit because women suffer from that so much,
I
and
know.
women actually leave cancer treatment because of vaginal health.
Yeah. And my response to them was during my chemo teaching, you told me what I should do to protect my partner if I wanted to have sex. So you could tell me that, but you can't tell me what to do if all of a sudden everything hurts when you're attempting to have sex. So I like,
I
how
know.
do we like cross
I
that
mean,
barrier to
I
get that
mean, like,
education?
how do we make men different? Like you could ask me, how do I make men different? And
For
I
the
just
five
think
and
it's a
six
little at a time.
play.
It's a little at a time, right? It's a little at a time that we do it. First, we educate ourselves, right? And the things that we know and that we can share, right? Like what I think is most admirable and what I love about the cancer community is that like almost every group that we're in touch with are cancer survivors, right? And so then they're like, this is bullshit. Like, I want to do something about it. And they all go about it their own way. But there's like so much word of mouth because who can you talk to if not somebody who's been through it, right? And so I think that there's an incredible power in these groups that you women have created and are forming. And I think that there's like sort of this hundredth monkey thing that happens in medicine. I didn't get to mention it, but so soon we're launching Good Clean Clinical Care. And Ashley, we'll make sure you have a coupon code or I don't know, Brent, I don't know, Penn Media will tell us how to
Yep.
do it so that women can go on there and have a discount and all that stuff. But like when we show them that when you give women medicine in a healthy base and you give them like this method to biomimic their way to health, I promise by the time I get to 10,000 or 20,000 survivors, doctors are going to start to pay attention. That's how they're going to learn. They're going to learn because women are going to tell them, well, it's too bad you didn't tell me this, but thankfully I was able to learn this. I think that's how things change, honestly, in the world, especially around women's health, right? Like you build it, you make the thing, people recover, and then just the gift of recovery, right? Like
Yeah.
then you're just like, oh, damn, all this time it wasn't me. It was
Mhm.
actually like what I didn't get, you know? And then it spreads, I think, like wildfire.
Yeah, the more we talk, I mean, it's a topic that I brought up at oncology a lot, or like at my OB, who was really more concerned for my risk of heart disease than anything else when she took my ovaries out.
Yeah. I mean, 100%. And I think really just speaks to the discomfort. Like it's a very weird country. And even I would go so far as to say world, right? Where we have sexualized everything. Just look at the Super Bowl, right? Like, pornography takes up over 50% of the internet. It might even be as high as 60%. And yet real conversations about having intimacy, about building intimate relationships, about living in our own body honestly and authentically. Well, like I said, the clitoral system was just mapped 3 months ago. 3 months ago. So that's actually unbelievably annoying.
Can I
And
can I ask one question while you're on that?
sure.
'Cause kind of following Jen's, I feel like my oncologist just wanted to give me vaginal estrogen, but I feel like from what you said, if I don't correct like the environment, the vaginal estrogen isn't going to do anything.
Well, so let me just say that. No, vaginal estrogen, if you can take vaginal estrogen, it's a great idea because
Okay.
that estrogen is actually doing that job locally of helping to provide the food for the right lactobacilli to live there. That might not be enough, the estrogen, but it's a good start. But actually, the vaginal estrogen that's given in standard of care is given in this really nasty propylene glycol base. And so would rather you get ours on good, clean clinical care so
I
that
feel
you'll
like
be
that's what
supporting
I
your
did.
microbiome too.
Yeah, I feel like it didn't do what it was supposed to for me, and it just did not make my
It,
vagina
pro-
feel good. And I was
it
like,
probably
why am I
burned.
using this if it is
Yes. So
so?
the reason it burned was not because of the estrogen, it was because of the base.
Got it.
And so when you use ours, and I know I've tested ours, I also was prescribed that and I couldn't use it for all the same reasons, except your vagina is probably even more sensitive than mine from all the things that you went through. Um, and I think you'll see that if when you use ours, you'll be like, oh, this is what it's supposed to do.
Got it.
S- but we'll also give you all these other things to really moisturize that space so that it starts to resemble the tissue you used to have.
I'm all
Um,
for it.
Not-
so, I mean, a lot of doctors won't even give vaginal estrogen. So the fact that yours would, I think is, thanks a lot, Jen. Appreciate you
Yep.
being here.
Yeah.
Um, I think the fact that yours it would is a good sign. Unfortunately, they don't think about what they're actually dispensing, just like in all medicine, right? We
Yeah.
don't think about what we're giving to women, and whatever. This is why I'm super excited about launching this platform, and I can't wait to just prove everybody wrong, honestly.
I'm all for it.
Love it.
Yeah.
Love it.
So. But so listen, I love working with you guys. We're gonna get you these codes. Maybe after we launch the clinical care, we could think about like doing another one.
Mhm.
Um, and then I can sort of share a little bit more experience about like what people have shared and done and how to approach medical situations that might be familiar to them and all that. So we'll just keep doing it.
Yeah. No, we'll just keep getting the word out as much as we can. That's what matters. So,
Yeah.
Thank you so
So,
much. I
Thank
appreciate
yeah,
it.
you.
So
thanks
helpful.
a lot. It was really fun. And I'll have Rebecca follow up with you on this
Okay.
code situation.
Yeah, and
Okay.
she's actually already been in touch. We've been emailing back and forth
Okay.
about it already. So,
All right. Awesome. Thanks a
Thank you.
lot.
all right,
Take
thank you.
Bye.
care.
Bye.
Bye.